tube feeding, nutrition, what is important for us to check on that bottle or that tube feeding?
To make sure it's in date.
Date,
The amount.
Make sure
whenever
it's the
you're
right
giving
kind.
it,
The right kind.
the right kind. A lot of times these patients' names are on these tube feedings. These tube feedings, a lot of times their name, what it is, because there's all kinds of different diets in these tube feedings. Could we make somebody feel pretty bad if we gave them the wrong one?
Yes.
Or increase their blood sugar, things like that. So I always want to make sure you're using the correct one, okay, and that you got your doctor's order, and the type of nourishment, volume, and then of course there's timing that's important too, okay? So we check the date, identifying information on the container and the tube feeding formula. We want to wash our hands. And then we've got our materials, although it probably says it later on. And we're going to enter the room, introduce ourselves, get the patient to say their name. Can you tell me your name, date of birth, like I should have done the last time? I think I went over that, but do it. And explain to them what we're going to be doing. Most of the time, these patients are not coherent. A lot of times, these patients are not coherent. But it's always good to what? Talk to them. Because just because they're not always totally responsive to you, they still can hear and understand a lot of the things that are going on around them. So it's important to talk to them, okay, and tell them what you're doing. Identify that, then we're going to distinguish the tubing. This is funny. Distinguish the tubing of gastric feeding versus IV fluids. It's funny, but it's not funny. Because, I mean, it would be pretty hard to instill this through an IV, but anything can happen. So just make sure you're instilling this into the correct tube. So, what do we want to check? We're assessing. So what do we want to assess before we put a tube feeding in on our patient?
Make sure lines clear.
Bowel
Yeah,
sounds.
bowel sounds.
By this piece of paper, that's what's first. Bowel sounds. So, what's normal?
5 to 30 per minute.
Mm-hmm. What's hyper?
More than 30 per minute.
And then what's hypo?
Less than 5.
Less than 5. Alright, so be listening for bowel sounds onto the skin. Listen on all 4. And they're present. We'll get you covered back up here. Alright, now what's our next thing that we want to do? Remember, we're assessing this patient before they're diabetic, okay? So what else do we want to check before we give them this tube feeding? Blood sugar, okay? And then we've already told them about the procedure. They should understand everything. And then it talks about planning. So you got to mention this, okay? So you go in there, and we're going to do it like a bolus is what this plan is, okay? But if they had tube feeding hanging, if they had tube feeding hanging, what would we do with that formula, the tubing every 24 hours?
Replace it.
Replace it every 24 hours because it can grow bacteria, okay? And the formula too, so the tubing and the formula has to be replaced. We're going to assemble our equipment, get everything together, which most times this is in the patient's rooms, okay? What you're going to be using is in the patient's rooms. So we've assembled our equipment, we've got all that, which is going to be that syringe, having your water and then your feeding, okay? Sometimes this feeding can be real cold. They say warm it. How would you warm it?
I send it in a basin of water.
Warm water. We don't put it in the microwave, right? No. So we're going to warm that, and then what's the last part? Because I wanted to wait to do this. What's the assessment we have it done for this patient before we give them food with their tube?
Checking the nose. Checking the areas, the nose, make sure it's intact.
That's good to do. You always wanna do that every time you do an assessment on your patient. But before I give them this feeding into this tube, what do I have to check for?
Oh, check the
Last part of my
residual.
assessment,
The residual.
the residual volume. We can't put anything in if we don't know what's already there, cause what could be there that would be very bad?
I'm sorry, fool.
It's already full. What are we gonna put them at risk for? Aspiration. So, we're gonna check a residual. That's where you're gonna wanna have backup container, okay? Cause what can we do with this syringe? We can fill it up, right? Okay, so, we've already washed our hands. I'm putting on gloves, I don't think there. Putting on gloves. 'Cause I don't want this on me. Okay. So, but I like to have a towel, that's just my preference. We've already told the patient what we're gonna be doing. Alright, so, we're gonna pull back on the syringe easily, okay? We're not gonna just, really pull back hard, we're just gonna ease it into that. And then you should start seeing, residual coming up through that tube, okay? So when we hub it out, which we don't wanna go too far, where do we go with this? To check the residual. So we know we've got 60. I've just pulled 60 back, but it would still continue going. So what do I do? Cause I gotta find the total amount that's in there.
Put it
For
in
the
the basin.
Thank you. So here's our little, it's graduated, tells us the measurement, okay? You gotta know your measurement, or if you can remember this, I wouldn't trust myself to remember how many times I pulled back on the syringe, so I'm gonna measure mine. So what do I have to do? Can I just pull this off?
No, you clamp
No,
it
you
too.
just take the plunger.
Clamp it, okay? And remove and inject our residual. Now, we're gonna go back. And I'm gonna pull back, and then it stops. So what do I do?
Measure it and then put it in place.
Okay. Me being me, I might just kinda push back a little bit and go one more time, just to make sure something didn't clog it. Make sense? That's just me, it doesn't tell us to do that, that's just what I would do. Now, put this in here, we're gonna measure it, okay? We had 70. So what am I gonna do now? I'm sitting in here, got this tube clamped. What am I doing next?
Close it.
It says refeed the gastric residual.
What do I do with this that's in here?
Put it back in.
Put it back in, that sounds really gross. So I'm gonna draw up 60. You see how hard, it's this way you need help. So you're gonna draw up 60, and then unclamp my tube. Don't forget to unclamp your tube. And we're gonna instill that back in slowly. That was not right. You see what I just did? Okay, now, we're gonna instill this back in slowly, okay? Does it say by gravity on there?
Yes, by flow of gravity. Refeed gastric residual by flow of gravity.
I don't know how I'm gonna do that. Okay, I know how I'm gonna do that. No, I'm not. I am. Alright, so I'm gonna get rid of that. I've got this clamped, right? Told you I hadn't done this a long time. Okay, now, what can I do?
Pour it in.
Pour it in there.
Okay, so I'm gonna unclamp my tube. And I'm going to slowly pour it. Now, the higher I hold it,
The faster it'll go.
the faster it'll go. And then, as it's coming down, do I wanna wait till it empties all the way out before I finish my other 15 cc's? No, you keep this syringe kinda full. Alright, so it's going down and it stopped right about here, okay? Y'all see where I'm at? Stop it about right here. Now, now, what am I ready to do? Am I ready to feed them?
Yes.
I'm ready
So
to-
what if when you're pouring it in there, it just all
Ma'am,
spills out? What if when you're pouring it back in there, it just spills out?
you just noted. You just lost them about 100 calories. Alright, so, now I'm ready to do my tube feeding, okay? Tube feedings are, they're made differently, you know, as far as sometimes, you know, but most of the time they're gonna be like in a jug like this, okay? So, my order is to give this entire bottle, okay? Sometimes it may not be. So now I'm gonna pour in till I fill it up and then unclamp my tube. Cause remember that fluid was sitting like right here, cause we don't wanna put a bunch of air in there, right? And so, and as that's flowing down to the tube, right till it gets to the end, I pour more in. So we're not putting any air in and we're gonna let it gravity, okay? So then we've put all of our feeding in. Right as it's getting to the end, we're gonna clamp it off here, okay? Talks about a G-tube, tilting this when you're doing the G-tube. Do y'all know why? Does that make sense? The only explanation I got is that that's gonna allow air to like come back up.
We call it venting.
Venting, yeah. And that's, to me, that's allowing that air's gonna be able to come back up if it needs to, easier if you've got that barrel tilted, okay? So now we've done our feeding. Now what's all in this tube now?
The feeding.
Just brown food, you know, that liquid food is sitting there. Do we wanna leave that there?
No.
No, so what are we gonna do?
Gonna irrigate it with saline,
I'm not very prepared, do I?
with 30 to 60 milliliters of normal saline.
Pull that back for me. Okay, so 30 to 60, I've got my water here. Got my water here, got 60, or I could have had a graduated container of water. Either way, and poured that in there, okay? So, this, it talks about irrigating. Sometimes I've seen people do this with gravity, and I've seen people also use a syringe, but what would I wanna do? Go really slow, okay? Just to ease that in there. You just want it to go, you know, real slow and ease that saline, or not saline, that water in there, okay?
Would you personally do it like that, or would you do it by gravity?
I'd rather do it by gravity.
Okay.
That's when I've seen it done. I've seen it done both ways, okay? But, so now I've pushed all that in, I've capped off right now, okay? What would be ideal is while you had that, let me go ahead and show it. While I had this clamped and that feeding was right there, I'd have me a little bit of water, but what did I put in here a while ago?
You
My
had
residual.
Residual.
You know, I already have like a cup of water, you know, that was measured here, okay? And then fill this, let it run, and by gravity, clear my tubing, okay? Either one I read was acceptable, to either push it real slow or gravity, okay? So now, we've irrigated our tube. Now our tube feeding is done, okay? Okay. Now, we're at the point now, we put a tube in, we fed the patient, and now we're at the point where this patient doesn't need this NG tube anymore, okay? So now we're gonna remove this tube from the nose, okay? And this is all on your steps, as you don't take a break, you know, you feed them and then you're gonna go straight to removing it, okay? So, what do we need to do before we pull that tube out?
The bulk is there.
Air. Is that what you said?
Mhm.
Because what do we wanna do? clear this tube, right? Of any fluids, anything that could be in there. So we're gonna use air to do that, okay? Of course, it's all falls in the steps, but when I explain this procedure to the patient, I would have said, I'm gonna give you your last tube feeding and then I'm gonna remove your tube, okay? And so we can clamp this tube. It doesn't mention in your steps removing the tape, but I feel like that we all know that we're gonna have to remove this tape, okay?
It's 28.
Yeah, it's
It does?
Yeah, no, 28.
Oh, I added it. No, it didn't. Yeah, it did. Remove, where do y'all see tape?
28.
Instruct the client to take a deep breath, hold it just before moving the NG tube.
It's right before that one.
I must not have the one y'all have.
You wanna see mine?
Yeah.
Yeah, you put it on there, you just didn't put it, nothing oxygen next to it.
Yeah, that's the one I made, okay. I grabbed the wrong one a while ago, so let me keep looking at that one. Make sure I don't mess that up. So, talks about inserting that we could clamp the tube as that water leaves the syringe, you know, where that's flushing it, okay? Then insert the tip of the syringe within the proximal tube to allow the solution to flow by gravity or applying gentle pressure. That's what we just did after we got through feeding, okay? Now we're gonna get ready to remove this tube, okay? We're going to instill that bolus of air that drains this our NG tube has been draining. We're gonna get all that fluid out of there, clamp the tube. Okay, so now that's cleared. Now, this talks about keeping that we gotta keep that, we gotta make sure we note whenever we're doing this, because we've just give that tube feeding, that the bed's gotta be elevated that 30 to 45 degrees for 30 minutes, right? We gotta say that out loud, okay? We're gonna wash and dry our equipment, okay? This, remember we had gastric residual in here. We gotta clean all this up, all right? Record how much feeding went in, and what else do we have to record?
The water.
The water, what we put in, okay? And then we're gonna remove that tape off the nose, and we're gonna tell them what we're doing. I know you're ready to get this out. Now, what do we tell the patient to do? They're gonna help us. Remember, we try to get them to help us do all the things that we do.
Take a deep breath.
Take a deep breath, and then remove it slowly and gently. And there may be even that point where you kind of have to, turn it a little bit. But we're just gonna remove it slowly. Because some of these are down in the intestinal tract. This one's not, right? It's in the stomach. Some of them go into the small intestine. And the folds of the small intestine there's valves that this has to pass through. So I believe, don't quote me on this, but I think it said you remove it, you move it every 10 minutes.
Mm-hmm.
Yeah, it's a pretty slow process. This, they're probably gonna want you to go a little faster than when I'm going. But you're gonna move that slowly, and then coil it up, either in your glove or on your towel. You always pull your glove over the top of it, and then throw this away, okay? I'm gonna wash my hands. You will enclose that in a towel or a glove. Remove gloves to perform hand hygiene, and then of course offering, to clean them up or giving them something to do so with. Most patients will want to clean themselves up. We discard any equipment, rinse anything that needs to be rinsed. Of course, our universal endings, okay? And then we're gonna document. And then there's all the things here on this chart, on the rest of the sheet, that tells you your evaluation, your documentation, and then your sample documentation, okay? So, our evaluation was that they got that prescribed formula. We're checking always weight to make sure that it stays stable. Lung lungs clear, we wanna think about bowel elimination. We wanna think about intake, we removed a tube. And then we also wanna evaluate if the patient, does resume eating, because, if that's the case, sometimes these are pulled because they can't eat anymore and it's the end of life, unfortunately. And make sure they don't have nausea, vomiting, their airway's clear, and then they have that moist nasal mucosa. And then we talk about documentation. I know this is getting boring. Okay. Volume of the gastric residual. What we did if it was greater than 100. What we did if it was greater than 100. Rate of infusion if it was continuous, because remember, we just did a bolus feeding. Sometimes these can be tubes connected and they're just getting a continual feeding. Response, any kind of actions we took if there was any problems. Type of tube removed, the response of the client, the drainage, appearance of that nose. And so then there's your sample documentation there, okay, that y'all are gonna go through. So that's all the steps there. Now, going back to our chapter 29, we're gonna do, whoever's recording, do y'all mind to continue recording?
You want me to continue recording it?
okay?
Yeah, that's fine.
There's a separate,
Here, let me
I
start
wanna
it.
separate it out.